In healthcare, we talk a lot about being patient-centered. But what does that really mean? How often do we put ourselves in our patient's shoes and think about what it's like for them? All ages, genders, economic status. With our patient engagement tool, we decided to walk the talk, really try to put it into action. Throughout this presentation, you'll see simple imagery and layperson language, no fancy healthcare terminology, because we've found that buzzwords and acronyms aren't easy to understand for most people. This is intentional to mirror the perspective of our patients. And before we describe our new tool, let me tell you a story. Meet our test patient, Karina. She's 38, a newly divorced single mom with 2 kiddos. To be clear, she's not a real patient, just a test case. Karina exercises frequently. She eats well, but she's been having insomnia lately, and it's getting worse, starting to affect her work. She worries sometimes what might be wrong with her because she has nasty headaches and catches every little bug. What would happen with her kids if she was really sick? She worries about this a lot. In fact, she worries about this all the time. One day she decides to get help. Here's Karina's challenge. Where should she go? There's a lot of options. How does she choose? She's sort of stuck in that quandary, not knowing where to start. She's troubled by multiple physical symptoms that may also be signs of anxiety disorder. Should she see a doctor? Should she see a therapist? She wants to feel better. She's motivated to make that first call, to make that first appointment. But how can she take ownership of her health if she's not sure how or where to find care? We will answer this question and return to her story. But first, I'd like to share with you a little bit about our challenge at Access Health System. So many options, so little time. Most new patients don't want to hear about our philosophy of care. They just want to feel better as soon as possible. In order for them to experience the benefits of our care, we just need them to get in the door, any door. Like many healthcare organizations, we have a lot of doors. We have 8 locations and a corporate office spread across 6,552 square miles and a number of small towns in rural southwest Colorado. Our integrated model means that each location has a mix of behavioral, physical, and oral health care, but each location is unique and different. This complexity can be really confusing for patients. One of our senior leaders said, "We need to hand patients a menu with all the options." It's like an all-you-can-heal buffet. Everyone wants choices, but too many options can add to that sense of overwhelm for a first-time patient. And overwhelm is not something you want your new patients to be feeling, especially when they're in a vulnerable situation. Access Health System has a lot of choices on our care menu. But really, any organization in this room might face the same thing. How do we get our patients in the door comfortably? A tool that helps patients figure out where to go and how to start could be really helpful. It would also be a great resource for front desk staff to quickly help patients get where they need to go. I love the questions on this screen because I know we've all felt this way. These are the lovely faces that greet our folks at one of our clinics, Cortez Integrated Healthcare. They get all kinds of calls appointments, crisis, needing questions answered. And we created what we thought was a simple tool for them. Only it was not so simple. We've all created flowcharts like this, right? This is our front desk decision-making flowchart. It's very thorough, but not very practical. I can say from personal experience from covering the front desk recently that there's no way I would be able to follow this because I'm getting calls, I'm getting questions, and some folks are experiencing a crisis. There's no way I can look at this in a time like that. There had to be a better way. But this chart was the seed of this idea. What if patients could make their own decisions and navigate their own way through our system? We decided to take a common challenge, new patient access, and address it in an uncommon medium. The timing was perfect. We were working on a complete overhaul of our website already. That meant completely rehauling the old site, which was less user-friendly, and transforming it into a new site that was very accessible for patients and available on desktop, tablet, and what we all carry, the mobile phone. We wanted our new site to reflect who we've become and involve patients in their care. And we're in the midst of this redesign, so we decided we wanted a signature feature that would allow patients to navigate through our system. To keep it simple, we called it the Care Finder. It's a digital, interactive decision tree. The image is friendly, the name is self-explanatory, the language is casual. Do you have a healthcare concern, but you're not sure where to start? Of course, we've all been there. Let's get you to the best care with the right provider at a location near you. There is no wrong door. All of our locations lead to whole person care. Patients can discover the Care Finder in several places on our website, including a button on the home page. When you click on the lead-in buttons, this pop-up window appears. Patients decide what their primary healthcare concern is. Then they click through a series of 1 to 4 questions. That leads them to the final answer, a single location with clear explanation of what they can expect there, and the ability to call for an appointment. On the emotional level, a simple quiz with definitive answers can help patients engage in less than 30 seconds. Plus, it's easy. It's even kind of fun. I bet you instinctively want to pull out your phones and start clicking through this to see if it actually works. Well, hold your horses. We will do that in a minute. Online self-quizzes are hard to resist, even if they are totally frivolous time wasters. I'd like a show of hands of those who have taken the quiz of which Friends character you are. I'm Monica, by the way, and I'm not always proud of that. Of course, we didn't invent the interactive decision tree. It's a visual algorithm with the goal of connecting you to what you're looking for. If you want to create one yourself, there are quite a few software options out there, and they're quick and easy to use, such as AnswerPath, Right Answers, Yonix. One of our marketing staff, our marketing manager, with design experience and some online software knowledge, chose Zingtree and taught herself how to use it. Now, I consider her a genius, but she reminded me that it's just not that hard to use. Zingtree provides powerful analytics to check on performance specifics, examine traffic patterns, and compile demographic data. We just launched the Care Finder on August 22nd in conjunction with our new website, and we already have some really interesting analytics to look at. It's cool if you enjoy geeking out on data, and I'll bet a whole bunch of people in this room do. Just to give you an idea, tracking the most popular buttons shows equal interest in medical care and therapeutic care. What's the average time it takes for someone to find an answer on the Care Finder? 28 seconds. And wow, that's way more people using their phones to access information than we even thought. From start to finish, the Care Finder was created by 2 people in about 20 hours, spread over 3 months, with the designer fueled by lots of lattes. This staff time included content development, setup of online software, and design of the tool. Another leadership staff member and myself supported with review of content, testing, and basically enjoying it. Our tree was created following the wizard prompt to create questions and answers called nodes, new vocabulary for me, to build each step of the process. A 3-minute tutorial showed us how to do this. Now, we've all got 3 minutes, right? Zingtree hosts our Care Finder for an annual business plan that we chose for $75 a month, which allows 1,000 end users to access the Care Finder each month, including analytics. And of course, we could increase that depending on users. The finished product is an at-a-glance way to visually explain our care options. This 24/7 tool helps patients learn where to start quickly and reduces barriers to finding the best care in the right location for them. Want to try it yourself? Take out your mobile phones. If anyone doesn't have a mobile phone, I will be shocked, but you can look at your friends. And go to our website, accesshealthsystem.org. You'll find it up on the screen, too, accesshealthsystem.org. And that will take you to our homepage. It looks like pretty much everyone has their cell phones out, except our colleagues who already know about this. They're not going to test this for me, apparently. Next, you'll want to swipe about 5 times. I had to learn to swipe. I'm old school, but it's doing this. Swipe 5 times, and you'll get to the bottom of our rolling homepage, and you'll see the Care Finder icon. Click on the blue button. It'll take you into the Care Finder. Nod if this is working for everybody. Okay. Before you try it out, scroll to the bottom of the Care Finder, and you'll find a back button that can take you to the prior screen, or a restart button where you can restart your search. Now I'm going to present a few test patients and let you make the choices for yourself. Here's the first case. Meet Ron and take a look at what he's going through right now. The symptom that concerns him the most is this. Go ahead and click through the Care Finder as you would if you were Ron, imagining yourself in his shoes. And remember, there's no wrong door. Now let's take a look at our friend Karina. How would you click through if you were Karina and these were the symptoms that concerned you the most? Go ahead and click through the Care Finder for her. If Karina went to see a primary care doc at one of our clinics, she would also be introduced to a behavioral health provider as part of her care team. And for someone dealing with the stigma of seeking a behavioral health care provider, this could be a big sigh of relief for her to be working in a care team setting. After a minimal investment in terms of time, staff, funds, our end result is a cool new tool that simplifies a complex process. But it does more than that. Our innovation is about empowerment. Marshall McLuhan's famous quote on marketing is relevant here. The medium is the message. What does that mean? We shape our tools, and then our tools shape us. The Care Finder is a signature feature of our website because it's a perfect example of patient-centeredness. We want patients to direct their own care and make their own decisions. They're at the center of their own health. Our care teams at 8 locations surround them and respond to their needs. Instead of feeling helpless, this simple tool empowers people to make choices and goals for a healthier life for themselves. And that's the end goal for all of us, isn't it? To support people in getting well and staying well. Thank you so much.